guys, today I'm talking to the beautiful Mary Jenner, a former paediatric oncology nurse who is also the founder of Butterfly Pig, a company that creates miniature medical toys so that children can play their way through understanding their treatment. The impact of these toys has been absolutely insane. They have seen a 112% increase in children understanding their treatments before their procedures after just one interaction with these toys, reducing the overall anxiety in the kids by 40%. It's amazing. Now she has just released her podcast called Care Rewritten that is bringing together health professionals that are on the forefront of discussing how we can better serve children and their families as they come into hospital to reduce the risk of long-term medical trauma. Obviously, guys, you know that this interview is very close to my own heart because I was a terrified little girl in hospital when I was just 4 years old. What Mary has built is exactly what I wish had existed when I was in the ward. So let's get into it.
Before we get into everything that you are doing with toys and children in hospital, I'd love to hear a little bit more about how you came to Butterfly Big.
The idea came to fruition back when I was working as a new nurse on the pediatric oncology floor. And it was where there was a moment where I had a 3.5-year-old patient and her parent wasn't at the bedside. And when I was getting a report on her in the morning, they said to draw her labs before she woke up because she was really scared of lab draws from her PICC line. So the PICC line's the central line. There's no pokes involved, but she had been a long-term patient. So who knows what she'd gone through, probably a lot of trauma around it. And I remember going into the room and she was awake and I was like, darn it, I lost my chance to get the labs while she was asleep. And it's in those situations, it's the healthcare system wants you to move fast and like get it done. And like we think, okay, we'll just, we'll get another set of hands and we'll have to hold her down. And unfortunately, that's a lot of the time what it results to. So this one, I changed what I was going to do and I decided to put an IV in her teddy bear. I asked her if she would like to put an IV in her teddy bear and she got kind of curious. And then I played nurse with her for just a couple minutes. It was like the most simple, easy thing. And then she trusted me after that and she let me draw labs on her own accord. And it just completely flipped the script and it was so quick and so simple. But then I remember I had to take the syringe with me as I was leaving the room because I didn't want her to like attach it to her own line. Yeah. And she was really upset. And I was like, why don't we have toys like this? Why don't these exist yet? So that's kind of where the whole idea came to fruition. And then it wasn't until like mid-pandemic on maternity leave, I had the time to start doing it.
To actually do it. Yeah, that is spectacular. I'm absolutely terrified of having that line done. And you're so right. It is that extra second that the nurse or anybody goes, hey, okay, what do you need? And actually sort of takes that time to explain it to you. With the Butterfly Pig, how did that name come up? Because I absolutely love the name.
I wrote a children's book years ago and it over a decade about now. And I just wasn't sure what to do with it. And I just always loved the phrase when pigs fly, not for the impossibility, but more the challenge of it. And so I wanted this book to exist where there is a flying pig. And I made a book and he's the only pig born with butterfly wings. So it's a story of inclusion and self-love and embracing differences. And so when I went to open the business, it just seemed like a natural melt because we want to teach those same values in kids, especially when kids are going through medical needs and feel othered and different than their peers.
So what is actually Butterfly Pig making at the moment? Because you guys have a massive range.
Yeah, we have over 100 different products. Did some batches of our dialysis play sets today. And we just got some of the butterfly needles, like the IV needles made as well. So it's all new stuff every day.
And what have you seen like with the kids and everything like that when you've been using them with the kids? What are the changes that you've seen?
It's really neat because it's most often what we hear from families is that the moment the kids see it, they completely light up and they get so excited, whether it's that they have medical condition and they recognize the device or their sibling does. We get a lot of parents who the child's siblings want to be involved in the care and like helping with G-tube feeds and all these things, but then they're getting them these toys instead. And it's so empowering for them to be able to be involved somehow. So that is where I think it's so impactful. There's so many different benefits to it, but I think just that initial reaction where they completely light up is what I love to see.
Oh yeah, that's beautiful. And I think it was so important what you just said. It's just like, it's not even just the patient, it's their siblings and their parents. And that is so important because when you've got that high stress situation, siblings can almost kind of get forgotten about. I know with
Yeah.
my own story that my brother was kind of like, he felt very sort of just like, oh no, this is my parents and Kim needs all the attention right now. And it kind
Yeah.
of, it does something to them as well. And also the parents, like that extra stress. So it would just like, it's a wonderful way for the whole family to come together and actually
Hmm.
like play and have some fun and kind of break those boundaries for something that's really scary. So I love
Right.
that. What's the favorite thing that's sold? Because I'm on like the needle thing for
My
me is
favorite,
my kryptonite. So I'm just curious about what's your bestseller. Like, what is everybody else
you
terrified
know,
of?
it's gosh, there are so many different products that I don't think there's a clear winner because
Okay.
like we have people coming to us for all different things. But I would say the ones that people love are the ones that are interactive, like the IV pole, you can
Mm.
put on the infusion pump, the feeding pump, there's
Ooh.
bags, and then the bags can connect to the actual lines or the G tube. So I think that those tend to be the ones that are the most fun for families because it looks exactly like what the kids get in the hospital.
Oh, that's fantastic. I actually I heard a story from one of the mums that you worked with about a kid called Elijah.
Yes.
Maybe you
Yeah.
could just tell us that story because it is absolutely beautiful and my heart was like, yes, Elijah, good boy.
Yeah. So that is actually we call him my nephew. It's my sister-in-law's sister's son, but we live very close together. And gosh, he was born around the same time I opened the business. And his mom would come work part-time at the Butterfly Pig with us as well. And I remember he had some upcoming echoes, and his mom was asking if there was any chance we could make an echo machine. And at the time, we hadn't really done anything that big yet. We were doing much smaller things.
Just quickly, what is an echo
Oh yeah.
machine?
Oh yeah, sorry about that. It's
That's
a
it.
the
That's
an
okay.
so it's an echocardiogram is it looks like an ultrasound machine because it's like an ultrasound of the heart.
Okay,
And
okay.
since this boy, our nephew was born with hypoplastic left heart syndrome,
Right.
so it is something that it requires a lot of surgeries and a lot of monitoring. So at a young age, he was needing a lot of these heart ultrasounds, and it's something that when a child gets wheeled in there, they have to stay still. It's a giant machine, and a lot of kids have a lot of distress around it, and um, a lot of fear around it because it's really hard to prepare them for that. So when we made this for her he actually on his previous appointments for the echoes she said that he was withdrawn or upset when it was happening and the very next echo after he had this toy she said he marched in there holding it and started teaching the echo tech how to do his own job.
I love
And
that.
yes, I it's the sweetest thing. And going forward, a lot of our cardiac stuff was made for him and he's thriving. But even like the chest tube drains we made for
Mm.
him too. And every time he's been an absolute champion with his surgeries. And his entire healthcare team comments on how well that he is taking everything and getting through it. And it's been a wonderful thing to witness.
That story of Elijah really hit home for me because it's something that, from my hospital experiences, something that I felt I was lacking my whole life that's caused a lot of mental issues for me is that feeling of being out of control that was taken away from me in the hospital.
Mm.
And I've gravitated to like a lot of different things, trying to find that control over my body and everything like that afterwards. And your toys give that back, that
Mhm.
empowerment, that control back in the hands of the kids. I think so many times we forget that what they're going through is such an adult experience.
Yeah.
So that when, parents, I know that they want to keep them so safe and not talk to them about this and not scare them, but there has to be a middle ground because otherwise they're completely in the dark, which is much more terrifying than
Yeah.
kind of learning about it. And your toys are just such a beautiful way to sort of like bridge that gap.
Right. And I know a lot of parents are hesitant because whether or not, a lot of parents obviously don't work in the medical field, but even if you do, it's different when it's your own kids. So like
Mm.
it makes it really hard to talk about. And you're not sure like how much to explain or what to do. So what we found is that parents are just so much more involved. And like we asked them once in a pilot study to like rate their level of involvement on a scale of 1 to 10 before and after the toy. And it was a 65% increase in having the toy available because
Amazing.
when you have something like a realistic tiny echo, you don't have to have all the words and know the explanations. Like you simply just play with your kid.
Mhm.
And it's because it looks realistic, that is already helping make the unfamiliar familiar for the child. So
Mhm.
there's still benefits in that and just play. So
Yeah.
it's really powerful, even when you don't have like all the right words or know exactly what's happening yourself.
Yeah, exactly. It's that insecurity of just like, I don't want to give you the wrong information and everything like that. And it's just like, well, just have a look at the toy. And it's just like, then,
Mhm.
you know, I think that's absolutely fantastic, because I looked at all your stats and they are so impressive. Children's understanding of their procedures went up by like 112%, and the anxiety dropped by 40%. I'm like,
Yeah.
that is mind blowing. And when we think about how that not only has an impact in that moment, but how that helps the whole way through their life, because the
Yeah.
impact of that surgery and that fear isn't such a massive traumatic impact on their brain. The likelihood that long-term mental health issues is reduced. So it's just absolutely fabulous.
Yeah, and we had quite a few families for gosh, the echo, the EKG, the EEG, all of those. I've had parents reach out saying that the previous times that their child had one of those done, the I guess I should explain too. The echoes, the heart ultrasound,
Yeah.
the EKG is the echocardiogram with the where you have leads all over your body, these little stickers all over your body, and then the EEG is what detects seizures. So it has like
Mhm.
the leads all over the head. So in all of these procedures, these parents were telling me their child, they were looking at doing sedation for the next time that they would need those done.
Yeah.
So they bought our toy as like a last resort, if you will, because they wanted to try to help. And so many parents are saying that they didn't have to do sedation for their kid. So that's where it like shows you how powerful something this simple can be for them.
Yeah. And just taking that time, that
Yeah.
communication, that extra care, just to explain
Yeah.
what's happening. Yeah. Oh, it brings joy
Yeah.
to my heart to just these, because I think at the moment, like, we talk a lot in the world about sort of like adults carrying all of this psychological weight and everything like that from like their childhood medical experiences. I mean, like, I'm prime demonstration of that. And it's like nightmares and hospital phobias and needles and everything like that. And do you think we are now like seeing how those dots are starting to fit together even in the healthcare system, or is kind of like the healthcare system still miles behind? And what can we be doing sort of better as
I
parents
know.
and then as healthcare professionals? Because that's the whole thing. There's two sides of every story here.
I know, and that's where I think that I think the biggest thing, the biggest gap that we still have is that the preparing and educating kids should happen before they ever like step foot in a hospital, if we can, right? Obviously, in like traumatic situations, we wouldn't have that luxury, but like the more that we can like prepare in a safe space, like within the home, that's where they're going to have so much benefits. Then once they get into the hospital, they have that foundation. But I do think that we are making quite a bit of progress. There's the whole term emotional safety, kind of what we're talking about, is trending right now. There's
Yeah.
a lot of new research coming out around emotional safety. I just spoke to a new role at a children's hospital where they have an emotional safety specialist, which is really
Oh,
cool.
fantastic.
And yes, and she's a former child life specialist. So, and that field is growing. The hard part is insurance doesn't recognize emotional safety and like preparation as essential to care enough to reimburse it. So I think
Yeah.
that is where we're not seeing the growth we need to. Because
Mhm.
once insurance starts reimbursing it, then hospitals will start funding it better.
Yeah, it's insane to me. And obviously doing this work, I mean, I had no idea that the emotional side of it anyway until I started doing this work. And it is amazing to me that we are still quite blind to the fact that that emotional safety is actually almost like your bones will knit together within like 6, 12 months, you know, your body will heal. But your brain is so tender at that age that
Yeah.
actually the cost of having this trauma and this like lingering mental health issues is going to cost a hell of a lot more
Yeah.
in the grand scheme of things,
Yeah.
and
We
especially to
talk
the
about that a
economy and
lot.
everything. Yeah.
I know, because it is like there's obviously the human cost of trauma, but then there's the financial one too, because traumatic care is distressing for everyone, the patients, the families, and staff. So then we
Yeah.
have burnout and turnover. Like it's easily costing the healthcare system billions of dollars.
Yeah, the ripple effect is absolutely insane. I think we just don't, there's not that consideration at the moment. um I'm very lucky because my traumatic and sort of like operations were all in England, so insurance is not a step
Mm,
that we have to consider. And I, every time I speak to anybody that has to go through the hospitals in America, I'm like, that is just a whole nother level
yeah.
of stress over your saving your child's life.
Yeah.
And I'm
Yep.
just like, that's just brutal. That is
Yeah.
absolutely brutal. I really hope
Yeah.
that changes at some point for you guys, because
Oh, I know. Me too. It's really hard to stay on top of because there are a lot of hospitals that are getting cuts to stuff right now, and it's been quite difficult to access these types of services for a lot of people.
Mm. So what would you say to a parent or anything like that that's kind of going through this kind of thing, that is struggling with the healthcare system and everything like that? Or do you have any sort of advice of kind of just like how that they can manage their child a little bit better
Yeah,
that's not going to cost them the earth? You know what I mean? How can
I
they do it at
know.
home?
I would say for them to know they're not alone, and there are so many parents that have gone through stuff before them too, and there are groups out there they could join, like on social media. We have a group that unites families and clinicians around emotionally safe care as well. But also there's like, gosh, there's home child life specialists where they'll come out to your home, or even schedule like a virtual meeting with one.
Yeah.
Those it would be like an out-of-pocket expense, but in the grand scheme of like how much healthcare costs, it actually is quite affordable and
Yes.
it has such a huge impact. But there's also a lot of child life creators on social media too, where they can follow them and see like there are so many that have helpful tips that they'll post, and there's different resources that are out there. So even if your pediatrician's office may not be following the best like trauma-informed care and preventing trauma with like vaccinations, for example, you can go find resources yourself and bring those and advocate for that when you're there. So like when I went to my daughter's last vaccination appointment, I asked if they had the Buzzy Bee, which helps like with the needle pain. And you can advocate for these things and ask for them, or even like buy them yourself off Amazon. But there's a plethora of support out there. It's hard to find at the moment unless you know where to look. So that's what we're trying to bring more together for families to be able to access those.
Yeah, that's awesome. And I will actually link that in this video, just anything, all
Okay.
of the resources that you give me, because then at least if anybody's watching this one, then they can know straight away where they can go to.
Yeah.
And I just wanted to kind of expand on that with sort of like where all these resources and everything are coming from. It is sort of putting it all together, but how could a parent sort of prepare their child? Sort of, do you have any kind of just little tidbits that you could give about how to prepare them at home and how to advocate in the hospital? Because a lot of
Yeah.
parents, when they get to the hospital, kind of almost go mute or feel so stressed out that they're in a unfamiliar area
Yeah.
that they don't have the power anymore, but they have their child. So
Yeah.
in that sort of space, what would you advise a parent to be like, okay, this is how you advocate for yourself and your child?
I have a whole podcast episode talking about that because that is such a, I've experienced it on both sides
Mm.
where I've been the disempowered parent, and like I end up quieting myself and being afraid to speak up for a stranger's comfort over my own daughter. And it feels terrible after the fact. Like, why didn't I say something in the moment? And it's like, well, I
Mm.
didn't want to come off as like overbearing. It's terrible. I believe that there need to be more resources in the hospitals to help empower families. So that's another thing we're working on. So if a family member wants to listen to like what we're working on in that podcast episode, it is the Care Rewritten podcast. It's on like Apple and Spotify, and they can see the one for parents.
Awesome.
But
I'll link that one in here as well.
okay. And for like if they have something upcoming, or you end up finding yourself in a hospital, depending on where you're at, I'm not sure, because I know in the US, most hospitals that have that see children should have a child life specialist. I think in other countries, they may be called like play specialists.
Mm.
So if there is that resource, they could at least ask if there's somebody like that. Because often what we don't realize is those roles help support the entire family too. And part of that is advocacy. So I think it's very helpful to have a support person. But then if it is just like they're at home and they're trying to figure out how to get their child to take medicine and they can't figure out like they're not able to swallow a pill or something, we actually have a free app on the App Store that is to help families have different play ideas around whatever they're going through. So that's called Playful Prescription. So you can put in there, I have a 5-year-old that needs to swallow a pill, and it'll pop out different play ideas to help with that process. So
Oh,
there's like different things you could type in whatever you need, and it helps pop out some play ideas. So that's another resource.
absolutely fantastic. Amazing. I think we've covered so much ground today, and it's just so wonderful to talk to you. Is there literally like anything you would like to just say to a parent that's got a child that's going through something really scary or a hospital right now, just to let them know? Because I know that you've had your own experiences as the mother as well as the nurse.
hmm
So I'd love just to sort of be like, what would you have wished someone had told you in that position?
I think the most valuable thing for me was knowing I was not alone, because I remember like the night of like where I had my traumatic event, I was Googling trying to find resources and I found a support group,
Mm.
and it's really wonderful to have when you need it. And then I mute it often because sometimes those posts come up and they're triggering. So it's something that like you feel free, or like go find the support, but then like feel free to like step back from it too. Like you don't have to be active in those groups if it seems to be triggering you. Just like try to take care of yourself, because in order for us to take care of our child's emotional safety, we need to consider our own too, because they borrow our nervous system. So it's if we're
Yeah.
all stressed out, then they'll be stressed out as well.
Yeah, I think that's so poignant. It's just like that passing on of that stress and everything like that. And to know that that's not your fault as a parent.
Yes.
It's not your fault. It is just a human evolution, nervous system thing. I had to be very polite with my own mother to be like, hey, yes, this is not a blame game that you were stressed in
Yeah.
hospital and now I've got stuff left over from that. There is nothing you could have done about that. You know, it's
Yeah.
just like it's putting all these little practices in where we are open with our communication and open about our emotions and our feelings and not afraid of them.
Right. And that's where when we're talking about this stuff is I think a lot of people feel like it is a conversation around like shame or blame and who did what. But it's when we're in these heated environments like healthcare, like people are working in survival mode and we literally cannot access the part of our brain that makes us think otherwise. So it is a very hard situation, and the system is just not built for humans in survival mode.
Yeah.
Yeah.
Awesome. Well, Mary, thank you so much for today. That was absolutely magic.